Any of you done much simulation? Okay, some of you have.
These emergency care providers
You can place IVs.
are getting experience on the closest thing they can find to a real pediatric patient.
They simulate everything. They simulate the pulses, they simulate the breathing. That's really neat. Really neat to work with because you really get a feel that the patient is real.
I worked the night shift. I came home from work and my wife said she had to leave and I just found him like this and he won't wake up.
They've come from around the state of Wisconsin and Illinois
25 to 40.
to the UW Health Simulation Program to learn more about emergency care for pediatric patients.
The healthcare providers are scared when a really sick kid comes in.
He's still seizing.
And so the only way to get good at something is to practice. And what we're doing today is offering participants a chance to really practice a lot and to bring some of what they learned today back to their colleagues wherever they may be working.
When McGill forceps are utilized, how far down the airway can McGill forceps go when properly used?
Specific training in pediatric emergency medicine is lacking for many providers, and many emergency responders just don't see that many cases.
I've been a fire medic for about 5 years, and I think that come to mind, I can think of 10.
For Ben Childers, a day of hands-on experience in a simulation center will be invaluable when he returns to his fire station.
I think it's going to help me with leadership because we've had a chance to take lead on some of these things in a kind of safe scenario and then get critiqued on that. So I feel like I'm going to go back to my fire station and be able to feel more confident in taking the role as leader.
I've mocked up this mannequin because I like the features that...
It's better to actually make your mistakes here in the sim lab than it is out in the field.
If no pulse, push analyze.
So it's really beneficial for everybody to come to a sim lab, especially with pediatric patients, because quite frankly, a pediatric patient, if you're not scared when a pediatric patient comes into your ER, then you're not one of the norm. Because it's frightening, it's the unknown. Pediatric patients can't tell you what's wrong with them, they can't tell you where they hurt. You have to figure that out.
There's a certain critical period for the providers to really intervene appropriately in the quality care in that critical period, but they don't have that educational piece. So therefore, where the pediatric emergency care physicians and the specialists come in is that they are looking for that quality educational piece. And for us, as a pediatric emergency care providers, provide the piece is that we are the experts.
Okay, I'm going to give the epi's in.
This is the Wisconsin idea. This is us bringing what we're doing here at the university to the state. And it's critically important because this comes down to our children and taking good care of sick kids. And not all accidents happen, emergencies happen just right around Madison or Milwaukee. And so being able to help train people to care for these kids and get them where they need to be is really important.